Good morning, everyone. Welcome to the IWH Speaker Series for November the 9th, 2021. My name is Peter Smith. I'm a member of the scientific staff here at the Institute for Work and Health. And it's my pleasure today to introduce Dr. Kathleen Dobson, who'll be telling us a little bit about some of her PhD work on examining the impact of depressive episodes on employment earnings among Canadian workers. Before we jump into the presentation, just a few things around the speaker series and asking questions. If you do have questions while Kathleen's talking, please do put them into the chat box and we'll have time to answer as many questions as we can at the end of the presentation. For those of you who are joining us for the first time, please do go to the IWH website, iwh.on.ca/subscribe, and you can subscribe to both our speaker series information and also our other information about our research here at the Institute for Work and Health. So, excuse me. So without further ado, I'd like to introduce Kathleen, who she's an associate scientist at the Institute for Work and Health, recently appointed, has completed her PhD in epidemiology at the University of Toronto in the Lana School of Public Health, and will be talking to us today around the impact of depressive episodes on employment earnings among Canadian workers. Kathleen, over to you. I'll join you at the end of the presentation. Bye.
Great, thank you so much, Peter. And let me just make sure I can see my slides. There we go. All right, good morning or potentially good afternoon, everybody. Thank you so much for tuning in today. I'm very excited to be talking about one of my doctoral thesis studies, uncovering the impact of a depressive episode on employment earnings among Canadian workers. And this is a very special study, and it all started with one simple little question. How much does experiencing a depressive episode cost a Canadian's earning potential? Simple, right? Well, we found through the study that it cost at a crude level a cumulative 10-year earning loss of about $115,000 for men and $71,000 for women. And if you're interested in seeing how we came to that answer, that's what I'll be talking about today. I'm going to be giving a background about why we decided to ask this question, how we came to this answer, and then take this study and these answers and understand them in our current context today. So, the place where I'm going to start is giving a background about the importance of studying the mental health state of the Canadian labor force. So, mental illness over the past several decades have become quite a burden to the Canadian economy and labor force. Each week, there's about 500,000 Canadians that aren't able to go to work or work due to a mental health problem. And the economic burden of mental illness in Canada has been estimated to be $51 billion per year, with $6 billion of this attributable to indirect costs related to lost productivity. So in attempts to reduce this burden, over the past 20 years, Canada has been a leader in different organizations, workplace standards, white reports, and changes to our policy aimed to improve the mental health of Canadian workers and the working age population. Now, despite all of this fantastic work, we've had a couple of pretty big gaps in our population level epidemiological evidence. And one of those gaps was quantifying the long-term labor market outcomes of those experiencing mental illness. And this was the area that I became quite interested in for my doctoral dissertation research. And to focus my research, I decided to study major depressive disorder because it's one of the most common mental illnesses in Canada. It has an annual prevalence of about 5%, a lifetime prevalence of about 11% in the Canadian general population, and typically it impacts women slightly more than men. Now, depression is a unique mental illness because it manifests as depressive episodes. So periods of at least 2 weeks where an individual is experiencing depressed or low mood, a loss of pleasure or interest in things, also various other symptoms and changes in their concentration, appetite, sleep, irritability, etc. Now, because they manifest as depressive episodes, hopefully they come to an end, making depression an acute type of illness. However, the majority of individuals who experience one depressive episode will experience another one across their lifetime at some point, and it's quite likely that they will do so. So it also makes depression a chronic type of illness. And this is important when we think about the Canadian labor force because depression can occur at any age. And this might influence entry into the labor force, progression in the labor force, as well as premature exit from the labor force. So with the population and clinical literature that we have in Canada, we know that about 30% of major depressive disorder patients are unemployed or on a disability leave. And then when it comes to those Canadians who are working and are experiencing depression, white-collar workers are a little more likely to experience a major depressive episode compared to blue-collar workers. And this isn't to say that blue-collar workers don't experience them as well. And among those Canadians who are working who experience a depressive episode in the past year, on average, they've reported about 32 days per year where their depressive symptoms have made it unfeasible or not possible to complete their work. And the last thing that we know is that among Canadians at the end of the working life, those who experience a depressive episode have an increased likelihood of early retirement, or in other words, premature exit from the labor force. And while this is all fantastic and very important information, there was one labor market outcome that we didn't know a lot about, and that were employment earnings. And it's a very important outcome to study because it's a proxy of career success. It's a component of our socioeconomic status, and importantly, it's a marker of our ability to access resources, especially if we experience a health shock like depression. So what we did know came from cross-sectional evidence. So evidence measured at one point in time. And we knew that working Canadians experiencing major depressive disorder earned about $3,500 less in annual income per year compared to those without depression. However, when we looked at this association over time, in Canada, we didn't really have a lot of literature on it. So looking internationally, we actually found mixed findings, with some studies actually finding no association between depression and subsequent income, and other studies finding that depression was associated with average income or earnings about $2,000 to $5,000 lower per year. So to try and come to a consensus in this international longitudinal literature, as well as fill this very important gap in the Canadian evidence context, is where my thesis study came in. We aim to quantify how experiencing a major depressive episode impacts employment earnings over a decade among working age Canadian men and women. We've recently published this study in the Journal of Affective Disorders, and I believe there should be a link to this study coming in the chat if you're interested in reading and diving into it. But for now, I'm just going to be giving a high-level overview of the study and what we found. So the first place I want to talk about is the study data that we actually used, because we had a very unique opportunity to link population level health data, which came in the form of the Canadian Community Health Survey. This is a cross-sectional survey that surveys Canadians coast to coast to coast about their health and health behaviors. And it's a representative sample of about 97% of the Canadian civilian population. And for the purposes of our study, we used all cycles that occurred between 2003 and 2014. Now, we had the very special opportunity to link the Canadian Community Health Surveys to administrative annual tax files. Each of these tax files covered roughly 95% of the Canadian census population. So this is anybody who filed a personal income tax return, their non-filing spouse and children. Now, the linkage of these two sources was a probabilistic one with an overall linkage rate of about 82%. And the way that we structured the data is that we linked each CCHS cycle to 6 years worth of retrospective tax records, and then prospectively all the way up until 2016. The population of interest for this study were working age Canadians who were participating in the labor force. So after applying our inclusion criteria for the study, so individuals who were of working age, who had information on their depression exposure, agreed and could be linked to the tax records, and then had earnings information 2 years prior to their CCHS cycle and earned at minimum $5,000 a year prior to their CCHS cycle. This resulted in an initial analytic sample of about 85,000 participants. The exposure in this study was a high likelihood of experiencing a major depressive episode in the past 12 months. And this was measured in the CCHS using a tool called the Composite International Diagnostic Interview Short Form, or the CDSF. And what this tool does is that it asks the participants about a variety of depressive symptoms they may have experienced for a 2-week period or longer in the past year. And after completing this tool, participants would have a score ranging from 0 to 8. So for the purposes of our study, we defined those who had experienced a depressive episode of having a score of at least 5 on this instrument. So 5, 6, 7, 8. And we just defined our control group, so those who had not experienced a depressive episode, of having a score of 0. And you'll notice that we excluded these individuals who scored between 1 and 4, because it was very important for us to have a clear distinction in our sample of who was experiencing depression and who was not. The outcome of this study were employment earnings, defined as total employment income from all paid employment income sources. This was measured from T4 slips. However, it did not include self-employment income. And the last important thing to know is that we treated this variable as a continuous one in 2016 Canadian real dollars. So after we got all of that out of the way, what did we actually do in the study? Well, the first thing that we did was stratify our data by gender to account for differences in depression risk, labor force participation, and earnings between men and women. Then, among each of the genders, we created a propensity score matched cohort. And to do so, we first created a propensity score for experiencing a depressive episode to capture the influence of key observed confounding factors on depression risk. And the confounding factors that we controlled for included a variety of sociodemographic and health factors measured in the CCHS, as well as 2 years worth of prior employment earnings, household income, and disability income from the tax files. Then after creating our propensity score that again, at a high level measures the probability that a participant had experienced a depressive episode in the past year, we used that variable as well as a participant's CCHS cycle, province of residence, age, and pregnancy status to create a one-to-one matched cohort. And the purpose of this was to create a sample that was as similar as possible on observed factors affecting depression risk and earnings. So in other words, what we really wanted to do was take, for example, a participant who was female from the 2003 CCHS cycle, who was 35, living in Quebec and had a certain health and sociodemographic profile, and match that woman to another woman who was from the 2003 CCHS cycle, living in Quebec, who was 35 and had the same profile, but the only difference between those two individuals would be that one had depression and one did not. And so after creating our one-to-one matched cohort cycles, we then used random effects multi-level modeling to quantify our association of interest. So after doing all of that, what did we find? Well, we found that our matching was quite successful. For the women in the sample, we retained roughly 90% of women who had experienced a depressive episode in the past year. So creating a sample that had 3,487 depressed cases and the same number of controls. For males, we retained roughly 92% of those who had experienced a depressive episode from the initial sample, resulting again in 1,810 males who had experienced depression and matched them to the same number of controls. Now, the next question is, what did these matched cohorts look like? Well, for both men and women, the average age was about 37 years old. Most came from the earlier CCHS cycles. About a third resided in Quebec. Very few individuals in the sample were immigrants or minority races. Less than half of the participants were married, and over 50% of both men and women in the sample reported another physical chronic condition present, and I've listed those at the bottom of the screen. And lastly, the average employment earnings leading up to the depressive episode were in the low $30,000 for women and high $40,000 for men. These graphs show the average annual employment earnings among the matched cohort, with women on the left, men on the right, and stratified by depressive episode status. So the individuals in the black line are the depressed cases, and the individuals in the blue line are our comparison, those who did not experience depression. And this was the story that came out of the data. The 2 years leading up to the CCHS cycle where depression was ascertained, we see that those who had and had not experienced depression had similar average earnings, and this is what we would expect because we placed these variables into the propensity score. Then the year that depression occurs, we see a dispersion in earnings happen, with those who had experienced depression having lower average annual earnings, and this difference remained for the remainder of the decade follow-up. Now, from our modeling, we were able to quantify this. So for a woman who had experienced a depressive episode, on average, her earnings would be $4,473 less the year that the depressive episode occurred compared to a woman who had not experienced a depressive episode. And for men, this initial difference was about $5,000. Then each additional year after the depressive episode, if a woman had experienced one, on average, her earnings continued to decline by an additional $363 per year. And this difference was relatively linear over the follow-up period. So 1 year after the depressive episode, her earnings would be $363 less on top of that initial $4,400. For men, we saw this earning decline grow over time, with 1 year after the depressive episode, on average, his earnings would be an additional $730 less on top of that initial $5,000, and then 10 years out, this would be about $1,800 less. So to put these numbers into a slightly different context, what we did was calculate the predicted earnings for those who had and had not experienced depression at each of the time points and calculated their difference and then crudely summed them up. And when we did that, we found the difference in annual earnings between controls and depressed cases was $71,000 for women and $115,000 for men. So I know I just threw a lot of numbers at you there, but here are some takeaways and considerations. The first thing our study shows is that a depressive episode was associated with an initial decline in earnings. The second thing that it showed was that there was a long-standing earning consequence of a single depressive episode. The third is that we see a matched cohort who had a high burden of chronic conditions. And lastly, we saw that trends were present in both men and women. And for the next couple slides, I'm going to dig into these key findings a little bit. So the first thing, as I mentioned, that we saw was an immediate earning loss due to experiencing or potentially recovering from a depressive episode. Now, the reason why that earning loss may be there is because these individuals might have had reduced productivity at work, potentially being passed up for promotions or other opportunities to increase their earnings. Secondly, these individuals may have been partaking in a disability leave or temporarily terminating their employment to recover from their depressive episode. Now, secondly, as I mentioned, we saw this long-term earning loss or potentially a scarring effect of a single depressive episode. And this might arise because there might be an interaction between depression, health, and some of the other sociodemographic factors we saw in these individuals. It might be that individuals with depression are selecting into lower paying work for a variety of reasons, or again, there might be a pathway through reduced productivity when at work, and again, perhaps being passed up for promotions or other opportunities to increase their employment earnings. Now, one of the really interesting findings from this study that I found was actually seeing the profile of individuals experiencing depression. Over 50% of both men and women had reported another physical chronic condition, and this was not including another mental health condition, which are also very comorbid with depression. But really what this shows us is these individuals, they're not just experiencing depression, perhaps they're experiencing other health and sociodemographic hardships. And the last thing to note is, again, we see some gendered differences. Although the trends in earning loss were similar among men and women, it's important to note the factors underlying them might be different for men and women, and this should be explored in subsequent research. Now, this study isn't perfect, and there's a few key limitations that you need to know about. The first is that depression was measured in the Canadian Community Health Survey in an optional module, which means that not all provinces included it at all cycles. This reduced our sample size and potentially generalizability. And the potential impact of this is that our results might actually be underestimated, because previous research that I've conducted has actually showed that CCHS participants who were not asked depression might have actually higher psychological distress levels. The second big limitation in this study is reverse causality. So it might be that a participant's prior employment earnings impacted depression, and that then impacted their future employment earnings, or there might have been a variable that we didn't control for. In whatever way you cut it, the potential impact of this is that our results might be overestimated. But just hang on in your seats in a couple slides. I'm going to tell you why I actually think we're in the right ballpark. And lastly, what I think is the biggest limitation of this study is that we only had one assessment of depression. So the potential impact of this is that the results may be overestimated for those participants who truly just experienced one depressive episode, but it might actually be underestimated for those with more than one. And this is something that I've continued to explore in my research after completing this study. So I've now given you a high-level overview of the study, and I'd like to now move from research to real life and place these findings in some context. So since we've completed this study, obviously the field of research has continued to move forward, and the trends that we see in our study have been mimicked in other research. So for example, the graphs on the left-hand side of your screen are from a Scandinavian study that shows employment earning trajectories before and after a sickness absence due to major depressive disorder. And again, we see a similar trend where leading up to the depressive episode, men and women with and without depression generally earn similar amounts, and then a large discrepancy in earnings occur after the depressive episode. Now, the study on the right is study of the association of severe trauma with work and earnings in a national cohort in Canada. And this study, although obviously a slightly different health state that they look at, had actually linked hospitalization data to the same administrative tax files that we had access to. And they again see that there's a big discrepancy in earnings that occurred the year of the health shock, the severe trauma injury, and then those earnings remained for the remainder of the decade, or the 3-year follow-up that they had looked over. So again, seeing this dispersion after a health shock that we see in our study has also been seen in other literature. Now, the other thing that's important to discuss is that since we've completed this study, the COVID-19 pandemic has occurred. And I think everybody on this call today would know that that has caused some labor force changes, as well as some changes in our population mental health that I would like to just take a little bit of time and talk about. So these graphs come from the CAMH, the Center of Addiction and Mental Health COVID-19 National Survey, where they've been surveying Canadians since May 2020 about their mental health. And what they have seen is that there's an increase in depression and depression symptom prevalence among the Canadian population. So if we look on the graph on the left of age, we see that the prevalence of depression among those 18 to 59, so working age individuals, is about 20%. And if you remember at the beginning of the presentation, I had noted that generally the annual prevalence of depression is about 5%. So we're seeing a massive increase in the Canadian population. When we look at gender, we actually see that the prevalence of depression in July 2021 is about equal in men and women, which again, if you remember at the beginning of the presentation, I had mentioned that it's typically higher among women than men. We also see that depression prevalence is slightly higher among households that have children in them. So clearly we're seeing big shifts at the population level. But a really important thing that this study highlights, and which is relevant for the study that I've presented today, is that they found that about 50% of those who are very concerned about their financial situation in July 2021, so the most recent evidence available, are reporting that they're feeling depressed, and about 32% of individuals who have lost their jobs or who have had lost their jobs in the pandemic, due to the pandemic, about 33% of them are reporting feeling depressed. And I just want to reemphasize this because I believe it highlights how important studying financial security, income, and mental health is today in the Canadian context. But on a slightly more positive note, one of the fantastic things that has come out of the past 2 years is the increase in Canadian mental health resources. This rapid review had found that there have been a total of 31 mobile apps and 114 web-based resources aimed to help the mental health of the Canadian population during COVID-19. And this again is mirrored by various provincial initiatives, national initiatives such as those by the Canadian Mental Health Association, as well as resources that are highlighted on many large Canadian city websites. And I highlight this again to shed a little hope on if we get Canadians who are experiencing mental illness the resources that they need, hopefully we can reduce this earning discrepancy that we had seen in my study. And with that, I would like to wrap things up for today. So this all started with a simple little question I was interested in answering. How much does experiencing a depressive episode cost a Canadian's earning potential? Well, if you ask the question the way that we did in our study, the answer again is a cumulative 10-year earning loss of about $115,000 for men and $71,000 for women. But given the current client context that we're in, I believe it's very important to continue asking questions. So the place I'm at now is to think about what questions should we ask next. So with that, I would like to thank my research team, Simone Bigod, Cameron Mustard, and Peter Smith, as well as the Canadian Institutes for Health Research, Statistics Canada, and the University of Toronto for supporting this study. And I'd like to thank you for your attention today. If you would like to reach me, my contact information is there. I have another little print screen of the study, and I'm excited to answer your questions and start a conversation. Thank you very much.
Great, thank you very much, Kathleen, for the presentation. Just a reminder to all of our participants, if you are interested in asking a question as part of today's presentation, please pop it in the chat box and we will ask as many questions as we can get to in the time we have left available to us. So there's also there's already a few questions in the chat box that people have been asking Kathleen. One is around the catching up. So you had indicated in your study that people had this initial discrepancy and then they were failing to catch up. You suggested that some of the individual type of resources that might be available, which might help people catch up. Are there other things that you think might be able to be done at a workplace level that, again, might help people catch up in terms of their earnings to people who haven't experienced a depressive disorder?
Yeah, that's a fantastic question, Peter, and definitely something that we've thought a lot about in the context of this study. And there definitely are things that workplaces can do. Obviously, the first is prevention. So an ounce of prevention is worth a pound of cure is the saying that we say in public health. But obviously, catching a depressive episode before it happens. But if the depressive episode happens, making sure the workplace is a supportive one with a healthy psychological or psychosocial work environment, and also making sure the transition, if these individuals do go on a disability leave, back to work, so the return to work process is as seamless as possible.
Great. A few interesting reactions to the CAMH information you had presented around just that large increase in terms of depression. Can you comment on whether or how depression was measured in the CAMH surveys? Is it similar to the information you had presented at the start of your presentation?
That's a great question. And obviously, throughout the pandemic, there have been a plethora of statistics about mental health in the Canadian population that have arisen. And I don't actually know how it was measured in their study. I decided to highlight it because it was the most up-to-date prevalence estimates that I could find, but I do know that they worked, I believe, with a consulting research agency, and I couldn't find what questions are available. It might be a little more of a crude measure, which might also, I have a suspicion. So perhaps that's why those estimates are slightly higher. However, other times throughout the pandemic, the prevalence of depression has been measured to be between 10 and 40%. But one of the nice things that I liked about the CAMH dashboard is, again, it broke down these trends by some really important groupings, such as age, gender, and again, the financial worries and brief employment information. So they might not necessarily be the most sensitive, but at least it kind of gives us a marker about what's going on today.
Sure, great. In terms of the impact on the resources that you had mentioned before around some of these expanded resources, do you have any interest or do you have any ideas about how we might measure the effectiveness or the impact of those resources on people's mental health as we move forward, hopefully out of the pandemic?
Yeah, so I think it's a very important thing to study and something that I hope to be able to have the opportunity to do here as an associate scientist at the Institute. And there are a variety of econometric and quasi-experimental study designs that we can actually look at the mental health and also the work and labor related outcomes of working Canadians experiencing mental health challenges, where we can measure what it was before and then after these interventions. So trying to get to the effectiveness of them. So that was a little bit of a long-winded answer, but the short answer is yes, and it's a very important thing that we should be looking at. Right.
So back to your study, there's a question here about understanding the impact. So we had seen some differences, I guess, in the impacts for men and women. But there's a question here about the impacts at people in different levels of the income hierarchy. So, for example, someone earning over $100,000, was the impact similar in a proportional sense to someone earning, say, less than $50,000? Did you have a chance to understand if the impacts were equivalent across people at different levels of the income hierarchy?
Yeah, that's a fantastic question, and for whoever asked it, is something that we thought a lot about as a study team. And what we actually found was over time, the effect was relatively homogeneous. So regardless of where you were in the income bracket, if you had experienced depression, your earnings were generally lower compared to those without depression across the entire study period. So that's what we saw in the data. Now, it's important to know that this is an area that should require further study, and practically speaking, those at the higher end of the income distribution may be slightly better off because, again, the more income somebody has, hypothetically, the more ability they do to have, the more ability they have to have the resources to access mental health interventions. However, we have seen in some Scandinavian literature where those at the bottom of the income distribution are more severely affected. So this is something that definitely should be further studied in Canada, and perhaps we can do some cross-country comparisons as well.
Okay, yeah, so there's, and I guess a related question that maybe, I don't know if you have additional thoughts on, just around within the sample, whether some people who did sort of, are there any characteristics that were associated with people doing a lot worse, or people maybe not doing as bad, or sort of people who didn't experience it? I guess what I understand is you didn't find any characteristics that were definitely associated with the amount of income that dropped in terms of what you looked at.
Yeah, so our study didn't aim to answer that question. Again, at the time when we had started the study, there wasn't a statistic out there that I could find, at least, that said, if you experience depression, your earnings will do X. And I thought having that baseline number was a very critical number for us to have for our Canadian evidence. But now that we have that, the next step is to tease that apart and look at the heterogeneity among Canadians, or working age Canadians experiencing depression, because obviously not everybody is the same. I would like to reiterate, though, in this study, we found it very surprising that we saw that half of the sample had reported another physical chronic condition. So moving forward in my research, I really want to explore, are those Canadians who are dealing with more than one health condition slightly worse off in terms of their labor market outcomes? And then the other part that goes to that is, again, looking at these the workplaces and the work-related factors these individuals have access to. Yes.
Okay, so there's a question here just around the depression measure that you used, and why do you refer to it as the likelihood of depression rather than, I guess, the diagnosis of depression?
Yeah, that's a great measurement question. So in population health surveys, when we include tools like the ComStat International Diagnostic Interview, they're not meant to be diagnostic instruments. It's, again, more to kind of give us a sense about how much of the population is experiencing depressive symptoms. So from the score, we can't actually tell if somebody would be clinically diagnosed with a depressive episode. However, previous measurement research has been conducted and has suggested that among those who had a score of 5 or greater on the CD, and again, it's the tool that ranges in scores from 0 to 8, if they scored at least 5, there was about a 90% probability that they may be diagnosed or meet the criteria for a depressive episode if we used more stringent measures.
Great. A question here just around earnings. So you had measured employment earnings. Is there opportunities to look at other supplements of earnings, such as disability payments, sick leave payments, in terms of better understanding the actual loss in income that people experienced over the time period?
Yes, the short answer is yes. Again, one of the joys about this study was working with this very unique data source, and there's a lot of information related to income that we can explore, and it's definitely something on my radar to continue pursuing. So hang tight.
Okay. There's a comment here just around the CAMH information, just around how those numbers are quite similar to the StatsCan numbers on the same metrics, but saying that one of the things which is on the StatsCan website is around the high rates of depression and anxiety among gender diverse individuals. And just to ask if you had any opportunities in your study to examine the experiences of gender diverse individuals and what the impact was of having a depressive episode for those people relative to other respondents in the sample.
Yeah, that's a fantastic question. Unfortunately, in this study, we didn't have the opportunity to do that. Unfortunately, the measures didn't allow for it. However, I think it's a very important segment of the population, and segment of the population that we, in terms of work and health research, that we should be exploring, and is definitely something that we need to continue to pursue in subsequent research.
Right. A question around you had mentioned that many of the individuals who experienced a major depressive episode also had one other chronic condition, or at least one other chronic condition. Could you describe just what types of conditions were often comorbid with the depressive episode?
Yeah, so the highest proportion of types of conditions were musculoskeletal conditions, as well as diabetes and some of the cardiovascular related conditions.
Okay. Question just around age. So I guess a lot of people quite interested in whether the findings differed across different subgroups. So a question about age, about whether the impacts of depressive episodes were more pronounced among, say, middle-aged respondents, people who are in the height of their labour market earning trajectories versus those that maybe at the start or at the end. Did you have any opportunities to examine differences across age groups?
The short answer is no. Unfortunately, that was the one little bit about the study that we wanted to conduct, but unfortunately, due to COVID-19, didn't have the opportunity to do. However, I will say a couple of things. First, if participants of this talk remember, the average age of both the female and male cohorts were 37 years old. So essentially, we had followed up these individuals or most individuals from when they were about 37 to 47. So a really prime time of one's working life. So subsequent research should kind of tease apart these differences, but we do know from other research that those individuals at the end of their working life, if they experience depression, it can be very damaging for pensions because those are some really prime, hard-hitting income years. But it's also very important to think about the early part of the working life. So those entering the workforce, because again, where they start kind of sets them off on their earning trajectory for the rest of their careers. And actually that is a question that I answered in my final thesis study, which looked at how depressive related mental health and employment earnings moved together from entry into the labor force among an American cohort over 20 years. So if people are interested in that study and those findings, that's going to be published hopefully soon, so stay tuned.
Okay, just another question around the comorbid conditions in terms of how you controlled for the different presence of comorbid conditions in terms of your analysis, and if they had any impacts on the earnings losses.
Yeah, that's a fantastic question. We explored it in a couple of different ways. So the first way that we explored it was including all of these conditions as their own variables. And we had at that time actually also included a couple of mental health variables too. We then tried grouping the variables in different categorizations, used it as a categorical variable, as a continuous variable, and we found that it really didn't make a difference whatever way we went. So in our final analysis, we decided to exclude the mental health conditions because again, we were really interested in the sole effect of depression and didn't want to have any of that effect removed by one of a potential mediator or a variable that shouldn't be there. And we had coded the variable as somebody had no chronic conditions, one chronic condition, or two or more chronic conditions. And most individuals in the sample had one other chronic condition.
Okay, just a question here. So you had mentioned during your presentation that not every province opts in to do the mental health component of the CCHS, which is somewhat surprising given the prominence of mental health in terms of public health and community health. But in terms of your sample, did you have a good sense of what your sample looked like in terms of how representative it was of the Canadian labour market? Like, did it span multiple different types of industries, different types of employer sizes? Is there any information that you could comment on in terms of how much your sample looked like a sample of Canadian workers?
That is also a great question. So I can give some very high level information. I will say it perhaps impacted it slightly. The unemployment rate might have been that we had seen in the sample might have been a little higher than what is in the overall Canadian population. But in the sample that we had, the vast majority of individuals had worked in the past year and were currently working, which again aligns with employment rates in Canada. about 75% of women in the matched sample were working full-time, which, and that didn't differ by depressive episode status. For men, there were, in the matched sample, there were about 20% of participants who were working part-time, and on average, women in the matched sample were working about 38 hours a week, and men were working about 45 hours a week. We had done a little bit of exploration in terms of the occupations of these individuals, but I would have to go back and look at those numbers to see how they match up to the distribution of Canadians in different industries in the overall
there
labor
were
force.
people from a variety of different occupations and industries. It wasn't just focused in one particular type of sector.
Yeah.
Great. We do have a little bit more time, so if people do have other questions, again, please, we get into the end of our questions, please pop them into the chat box, and we will have time to ask them hopefully today. In terms of just another question, just around the income distribution, somebody noting that often in people after work injury, there are some people who do really poorly and some people do a lot better. Did you look at the distribution of income in terms of your sample, and did it look, I guess, did it have sort of two different distributions, or was it sort of a single distribution in terms of the income among people who experienced a depressive episode?
Yeah, so we actually found it was one distribution. It was a very homogeneous distribution. And we were a little surprised by that, because we had also thought there might have been part of the population who did quite poorly after the depressive episode, and then those who bounced back, but that wasn't what we saw.
Okay. So I think there's one final question here in the chat box, which is, so Kathleen, what are the next steps that you think you'd like to take in terms of either this particular data source, this linked data, or in terms of the areas of mental health and work as you start your independent research career?
That is something I think about every day, but I will give a teaser about two things. So continuing to work with this data source is something I'm very interested in doing, and there's a couple of avenues that I'm going to hopefully take things in. The first is to continue to study the labor market outcomes associated with other mental disorders, and particularly those that have a gendered profile. Starting with major depressive episodes, and major depression was, as I had mentioned in my presentation, a really important place to start because it's one of the most common and prevalent mental illnesses, but there's a lot in Canada that haven't had that type of study. And given the gendered differences we see in the labor force as well, I think that's a really important avenue to explore. The second thing is, as we saw in this study, all it can really say is if you experience a depressive episode, your earnings are impacted like this over a decade. And so I think moving forward, it's really important to see how different workplace policies, access to treatment, and again, other factors that might fall along that pathway, how that impacts if individuals catch up in their earnings. So, and then as one of our participants asked about the variety sources of income, that's something I'm definitely interested in exploring as well. So that's one avenue. And the second avenue is from my doctoral research. I was very surprised to see that we didn't see a group of individuals with depression who were thriving in the workforce. And I think anecdotally, we all know somebody that is. And I think uncovering what are the factors that are making individuals with depression thrive in the labor force and do very well in their careers is really important, because it'll give us a place to see if we can take those factors and make generalizable policies and interventions. So everybody who experiences mental health challenges can hopefully have the happiest and healthiest working lives that they can.
Great. So very important work ahead. So thank you everyone for joining us. If you didn't, or if your question pops into your mind after the presentation and you want to email Kathleen, you can do so. Her email is on the slide in front of you, and also in the chat box as well. And you can also get her on Twitter as well, at KG_Dobson. For those of you who are joining us for the first time or would like to engage more in our speaker series presentations, there's a link at the bottom of Kathleen's side to the IWH speaker series website, iwh.on.ca/events/speaker-series. So please check out that website for all of our upcoming speaker series presentations. Our next speaker series will be on the 14th of December, where IWH scientist Arif Jetha will be talking about the future of work for young people with disabilities. We will pop in a link to that presentation in the chat box. And so for those of you who want to attend that, you can either go to the speaker series website or you can follow the link which will be placed in the chat box. There it is just there. And you can register for that presentation on December 14th. So thank you, Kathleen, once again for the presentation. Congratulations on finishing your doctoral work, and lots of other congratulations come into the chat box as well. Great presentation. Thank you everyone for attending, and we hope to see you at the next speaker series presentation in December. Thanks everyone. Enjoy the rest of your day. Bye-bye.
Thanks everyone. Bye.